Most of this session has been on the assessment of trainees, but although we also wanted some perspective on the assessment of faculty, although this is a big topic and we couldn't take this on entirely as well. But we gave these guys a hard talk and asked for their thoughts on trainee assessment of faculty best practices and challenges. Anne and Alykhan, thank you very much for doing this.
Good afternoon. Thank you. The goal of this talk was to survey some residents and evaluate best practices and challenges for trainee assessment of faculty. Residents at LSU and other integrated programs as well as some general surgery residents were informally interviewed. The following questions were asked. What mechanisms are available at your institution to evaluate faculty, and what do you prefer? 3 types of feedback were noted. First one, direct face-to-face feedback. Secondly, online feedback and assessments. And finally, the possibility of smartphone applications. Direct face-to-face feedback was most commonly reported. This included post-operative reflection, often looking at how both faculty members and residents could have performed better during a particular case. This can be vague and sometimes not critical enough due to the following challenges. Time crunch in a busy practice, discomfort of giving feedback to your teacher, and also the initiation has to come from the faculty. Another important form of faculty feedback is resident roundtable meetings and biannual meetings with the program director. This is not real-time feedback for individual faculty members, but it was very useful and provided good overall feedback of teaching in a safe environment. Online evaluation of faculty members was also very common. At our institution, new innovation was used for surveys. At other institutions, there were similar programs that people used for end of rotation and annual surveys. These forms oftentimes can be lengthy and just become a checklist. They are, however, anonymous and can be a powerful tool, which is not as uncomfortable as directly speaking with the faculty members. A new form of technology that has recently been applied for resident feedback are smartphone applications such as Simple and M3. This technology is rapidly advancing and could be tweaked to help with real-time faculty feedback in addition to resident feedback. Currently, it's only available for resident feedback, but it can potentially become a useful tool in the future. In conclusion, direct face-to-face feedback has proven to be very helpful, and for most residents, it shows that the faculty care and have a desire to help improve our education. Integration of other technologies may be helpful in the future for real-time feedback. No apps currently exist, but for faculty feedback, but there are apps for resident feedback that can easily be tweaked. And online feedback is currently the most common tool available to residents to evaluate their faculty members. If made more concise, this tool can become very powerful and help complete evaluations.